Hi guys, Shanique here, and we are going to be talking about fructose and fruit today. A lot of people were kind of freaking out, asking, well, is fruit really bad for me? And here's the answer. It's different for every case. So let's first go over, you guys understood what glucose does in the body and then what fructose does in the body, and it's like two absolutely different reactions. So now you get fruit, and let's use a banana for instance, and it has 20 grams of sugar. About 10 of those grams are fructose, 10 of those grams are glucose, okay? So the glucose is gonna be metabolized with all the cells, turned into glycogen stores, all that kind of stuff. And then the fructose is gonna be metabolized sort of like how I explained, but there's a catch, because fruit has things like polyphenols and fiber. And what that does is it slowly exposes your liver to metabolizing fructose. Not only that, but there are enzymes that help with your body's metabolism of that. And some of that fiber brings that sugar down into the lower intestines to feed the healthy bacteria, because it's attached to all of that fiber. So it's really good for you. Now, for the most of you, okay? Now, if you have insulin resistance, if you have weight issues, if you have hormonal issues, then any kind of spike in insulin is going to be problematic for you, because hormones kind of work in a, I can't say trifecta, what's a fourfecta? You have thyroid hormone, you have adrenal hormone, you have your sex hormones, and then you have your insulin. And they all kind of work together like a beautiful symphony. And when they are off, when one of them's off, all of them is off. So if you have something like insulin resistance, you have other hormonal imbalances that are affecting you. So if you have like thyroid disorders, or if you have PCOS, or if you have PMS or something, you need to be very careful about upsetting one of those four legs, and that one of the four legs being insulin levels, right? So check your symptoms, check your hormones. If you have a lot of hormone symptoms, you want to be careful with your insulin intake, or your insulin, I guess your body's ability to provoke insulin out of you, right? So this is kind of a golden rule that I like to give my clients that have some health issues. For every 5 cups of vegetables you eat, you can eat 1 cup of fruit. Okay, and again, there's still a lot of really good stuff from fruits and from fruits, and the fiber and the vitamins and the minerals and the antioxidants, and those things all help your body metabolize the fructose out of there. Okay, and again, it's not all fructose. About half of the fruit is fructose. There are some things you want to be careful for. For example, mangoes, or dates, for instance. They are almost all fructose. Now, other symptoms to look out for: if you have any other kind of autoimmune disease like rheumatoid arthritis, or none are coming to mind right now except rheumatoid arthritis. The insulin spike is going to, or the insulin increase, I can't say spike because it's not going to spike, but it is going to increase your insulin. That insulin increase will trigger or aggravate an already aggravated immune response. So you want to kind of be really careful with your fruit intake. Fruit is not the bad guy, it's just your history with other sugars that has kind of hypersensitized your body. Hopefully that makes sense, guys. Still eat your fruit. Just keep in mind some of those other factors that could potentially be hindering your body's ability to heal. And that's it. Hopefully you guys feel a little more comfortable with fruit now, okay? Enjoy your weekend full of fruit and lots of vegetables.